Hello, this is the Montrose County COVID-19 update. This is Dr. Joe Adragna, Medical Advisor to the Public Health Director. The date is April 6, 2021. Let's get into it. If you haven't already signed up on our standby vaccination list, please consider doing so if all the vaccine slots are already taken. But if you're watching this before Thursday this week, there are still slots available on the clinic this week. So please try and pick a vaccine time that works for your schedule. And if they are all taken, please join that standby list. You can do so by going to montrosecountyjic.com/vaccination or by calling 970-252-4545. So, who is now eligible for COVID-19 vaccination within Montrose County? We are in what CDPHE calls Phase 2, which is anyone ages 16 and over. Now, note that for 16 and older, that's only applicable to the Pfizer vaccine, and 18 and older is from Moderna and Janssen. But good to see everybody and anybody is eligible for vaccination now. It doesn't matter what your health history is or what your profession. You can sign up on our website, montrosecountyjic.com/vaccination, to pick your own vaccine administration time at the Friendship Hall Vaccine Clinic, scheduled for Thursday, April 8, 2021. If all the slots are taken, please sign up on the standby list, which is found just to the right of this sign up button on montrosecountyjic.com. And if that doesn't work for you, just give us a call at 970-252-4545 and press option 1. We will get you taken care of. If you do sign up on the standby list, generally people are getting in within a week or two. We do have people that do not show up for their appointments, and we will call you that day for a short notice, but if you can make it, we'll get you that vaccine. This week we are anticipating around 820 to 1,000 vaccines being administered. That's a combination of second doses and first doses. Second doses for Moderna and first doses using Janssen. If we look nationally, 167 plus million administered doses and 208 million delivered doses nearly. If we look at how many of those vaccines have been administered at 167 million, of those 107.5 million are to people with at least one dose. Think about that for just a moment. Nearly 108 million people with at least one dose. So if you've been sitting on the sideline wondering if now's the right time to get the vaccine, I think with 107.5 million people with at least one dose, you should have enough information out there to make a decision whether this vaccine is right for you or not. Fully vaccinated, we're at 62 million across the country. And if we break down who's receiving those vaccines, it's generally people age 65 and older, but we see increasing percentages in the younger groups as their eligibility becomes more open across the country. And again, here in Montrose and in Colorado, all ages that are 16 and up are eligible depending on the manufactured vaccine available in that county. Remember, Pfizer 16 and older, Moderna and Janssen 18 and older. If you look to the graph below the CDC figures, the table in blue and gray, this is the state CDPHE vaccine data set. So we've been tracking this every week. If we look to April 5th, we now have 1,210 vaccine providers. It continues to grow as more vaccine providers sign up and enroll. In Colorado, 1.8 million Coloradans with at least one dose and 1.1 million fully immunized with cumulative doses at nearly 2.9 million doses. So tremendous job right here in Colorado getting a lot of our community vaccinated. If we look at the vaccine distribution over time, you can see that shown here. Blue is our Pfizer vaccine, red is Moderna, green is Janssen, and gray is unspecified. You can see that we are just slightly above our early March peak in this early April vaccine push that's kind of hiding under this reporting window language here on the right side. Point is, we've had a growing number of vaccines being administered across the state, and we see that people are, as they become more and more eligible, now everybody being eligible, they have taken advantage of the opportunities to receive that vaccine. And right here in Montrose, you can receive vaccines in medical offices, at the public health clinic, and at many pharmacies across town. If you want to know where you can find a vaccine provider in town, go to montrosecountyjic.com. That's montrosecountyjic.com, and there's a list of eligible vaccine providers. If we look at doses specifically out of our region, that region defined as the West region by CDPHE, that contains Delta County, Gunnison, Montrose, Ouray, San Miguel, and Hinsdale, we see in this graph that Montrose has administered nearly 22,000 doses of COVID-19 vaccine through all of our efforts, public health, pharmacies, and private offices, medical offices, including our hospital. If you look at who's receiving those vaccines, the 60 and plus still dominates in the number of or percentage of those vaccines being administered, which is great to see in our high-risk population, but again, continuing to see rising percentages in our younger populations. We still see that females dominate in the percentage of gender having received the vaccine, and we have a race and ethnicity breakdown here on the bottom right graph. If you look at Montrose's distributed vaccination amount compared to its percentage of the state population, we remain in the positive, just slightly at 0.07%, meaning we've gotten just slightly more vaccines distributed to us than our relative percent of state population, and largely that's through advocacy efforts and a vaccine clinic that we held for underserved populations that allowed us to tap into some additional vaccine resources that the state had. Let's look at COVID-19 infection stats. Now, so if we look to the state, this is the dial dashboard that CDPHE has. You can see that Montrose is shown in blue. We were in blue last week. With the figures that we have been seeing in terms of cases, we believe that we will go to green this week. Expect an announcement on that through MontroseCountyJIC.com and through local news releases, but I suspect we will go to green on the dial dashboard this week. If we look at 1 week cumulative incidence, Montrose has been less than 35 cases per 100,000 population now for 7+ days. And when we look on 1 week average positivities by county, we remain less than 5% on our percent positive. If we look at number of days with decrease in our stable hospital admissions, Montrose remains at 14 days with decreasing or stable hospital admissions, and that puts us in blue right now. If we look to the dial, and the three metrics that they're looking at from the state level, that's 1 week cumulative incidence, that's 1 week average positivity, and the decline in our stable hospitalizations. Comparing last week to this week, we see that our cumulative incidence is down slightly to 30.4 from 32. Our percent positivity is down slightly at 1.9 from 2.1, and we're stable on the days of declining our stable hospitalization. If we look to this graph, we see two data points here. In gray, you're looking at the rolling 14-day cases per 100,000 population, and the black line is showing you Montrose Hospital census for COVID-positive patients or persons under investigation, meaning they're pending a test result. We see that on the bottom right of the graph, we still see cases in Montrose. We're actually up from a nadir of cases in late March, but we see that our hospitalizations remain flat, with 0 patients in the hospital meeting COVID positive or PUI status. If we look to our model, the model is shown here in dark blue. That would model that we would expect 0 hospitalized COVID positive patients. Now, this does not look at persons under investigation rates, but given that Montrose Hospital has the ability to do in-house highly sensitive PCR COVID-19 testing, we do not have very many PUI admissions to the hospital any longer. They're tested and either rolled in or rolled out. So we see that the model projects that we would have 0 census going forward. That's with a 0% public health effectiveness from March 1st. The model was last updated on March 1st and has not been updated since that point, but the graph has been updated to show COVID positive hospitalizations. And so we do see that there was a little bit in March when the model had projected 0. We'll see a little bit of fluctuations there just because we have an overall small sample size. Some risks to the model: we don't factor in the risk of variance. We don't factor in waning immunity, which may happen. We just don't know how long that might take. It could be months. It could be many years. We also have a risk of a concentrated high-risk exposure, but that's becoming less and less of a potential in Montrose County as we see higher and higher vaccine uptake rates. And there also may be an overestimate of the immune population size because we don't know how many people having received a vaccine also had a natural recovery. And in the model, what we do is we say that once that person has a natural recovery, which is modeled, of course not actual, they're taken out of the susceptible pool. And we do the same thing once we have somebody that's fully immunized. And so we may be double counting somebody. Let's take, for example, Joe goes and gets a vaccine, and Joe doesn't know that he had COVID last fall. Remember, many people were asymptomatic with it. And so he gets a vaccine thinking that he's never had recovered from COVID and doesn't have antibodies from it, but maybe he does. And so in this situation, we would double count Joe. So there's a little bit of a risk that we may be overestimating the immune population. But at this point, we estimate that more than 30,000 people within our county of 42,000 either had a natural recovery and or had full immunization. And so that's 75% of Montrose County. And I think that explains why we're seeing dropping case counts, and we are seeing our hospital census stay very low, and particularly because many of those populations that are high risk have had first dibs at the vaccine. So if you haven't got the vaccine, but you're on the sideline thinking about it, please consider it. I think you're going to do a great job in keeping this vaccine rate high and keeping the virus prevalence in our community low, which is going to continue to keep case counts low and keep our hospitalization levels low, which will allow us to open up more fully, more quickly. If we look at surrounding counties, we see that there has been an uptick in the number of cases detected over a 14-day basis as we report today. If we look at those counties specifically, the ones in red have an increase in the 14-day case count compared to last week. So those counties would be Delta, Montezuma, Mesa, Gunnison, Summit, La Plata, San Juan, and Garfield. Montrose is stable from the report last week, but we still remain above our 14-day case count as assessed on March 22nd. On that date, we had a nadir of 61 cases per 100,000 in the preceding 14 days. We went up to 77 as of the report on March 29th, and we remained stable at 77 cases per 100,000 as of April 5th. So because this graph does take it as a cases per population level, this is essentially looking at community prevalence levels of the virus. And so Delta County has a higher prevalence level than Montrose does at this point. But of course there are biases and risk in making that type of determination, such as availability of testing, interest in testing, etc. And so the takeaway here is that the region, as we define it here in these counties, has seen an increase in cases overall. It's a slight increase, but it is higher in total than we saw last week. Let's look into this some more detail. If we look at the CDPHE's more narrowly defined region, which is Delta, Gunnison, Montrose, San Miguel, Ouray, and Hinsdale, we do see that Montrose, San Miguel, Ouray, Hinsdale, Delta, Gunnison, all as one group, the West region, did recently have an increasing case count on a 3-day daily incidence average. And so remember, we were just talking about 14-day cases per 100,000 population. Now we're looking at a 3-day average daily incidence, and the black line shows you what we'll call the smoothing trend line. The gray dots are the 3-day average daily incidence calculated on that date. And the bottom graph here, shown in red or green, depending on the point of the line, is showing you what the daily change in the slope of the smoothing trend line is. And so if that bottom line is red, it means that the black line above is increasing in its slope. And so if it's green, it means it's decreasing, and if it's right at 0, it means it's flat. So we see here that we'd gone into red just recently, so we had an increasing case count on a 3-day average daily incidence, and then it started to flatten out just about March 31st. And now at April 5th, we're at a negative 0.062, so that's barely any negativity on that trend line, but it is a negative, and that means that we are seeing decreasing 3-day average daily incidence, and that can accelerate, and it can also slow down and go backwards. But what that would indicate is that in the next week or so, if that trend continues, we should see overall fewer cases within this West region definition. So let's talk for a moment about variants. The title says COVID variants, 0 of the following in Montrose. That's actually a typo. We actually do have one variant here in Montrose. This is the first weekly report where we are detecting and reporting a variant. That variant was the B117, or also known as the UK variant. This variant is more transmissible than the standard strain of COVID-19, and we've had Montrose County with one report of this variant being detected. There are many other counties around the state that do have this variant as well. The South African variant, B1351, is stable in the number of counties that list this variant, being Chaffee, Moffat, Pueblo, Sedgwick, and Teller. And then the California variant is found in many different counties within Colorado. And if you're looking for specific county-wide information, you can look at CDPHE's website. If you're looking for the 7-day average of COVID-19 cases across the state, that is shown graphically here. And if we look to the right side of the graph, we do see an increasing number of cases on a 7-day average, up from a low point in late March. If we look at the state as a region, we do see that that increasing 7-day case count is also reflected in an increasing 3-day average daily incidence. In the smoothing trend line here in the black line, you can just visually look at it and see it's going up. That would correlate with an increasing daily incidence on a 3-day average. If we look to the bottom graph, it just confirms that by showing you it in red. And so that the change in the slope of the smoothing trend line is positive, which in this graph is shown as red. Now, unfortunately, it looks like it peaked in the last week of March and then has started to come back down. It's still growing. It's just growing at a slower and slower rate until hopefully we'll hit 0 on that slope of the smoothing trend line, the bottom one, and that will indicate that we've got a flattening of our 3-day average incidence. And then the next thing we would hope for is that the bottom graph goes into green, which means that we're starting to pull back on our 3-day daily average incidence, and that smoothing trend line is starting to go down, indicating fewer and fewer cases. So what's the impact of this on hospitalizations? Let's look to the bottom right for that. If we look here, we do see a slight uptick in the last week or two in COVID census. That's for confirmed and PUI status. Now, if we look ahead, though, up to the top graphs, on the left you'll see acute care bed in use, and on the right you'll see ICU bed in use. Those are looking pretty good. In fact, we have stable 0% change on a 7-day average from last week on our acute care bed use, basically a flat line of the average, which is shown in red. And on the ICU bed use, we're down actually 2%. We have 2% fewer 7-day average census from today compared to 7 days ago. So ICU beds more available. But basically, I would read these as stable. They're essentially going to fluctuate a few percentages here and there. Unless we see significant changes in demand, we'd expect them to stay about there. If we look nationally, this graph shows you new cases by report, not adjusted by population, but just in total, across the country, broken out by counties. And this is from March 28th through April 3rd. We see that Montrose County is shown in a light green color, and we see that there has been some darkening in colors in some of the counties of interest, particularly down in Arizona, and we do still have some darker colors on the front range. And that concludes our April 6th, 2021 COVID-19 update from Montrose County and Montrose County Public Health. I appreciate your attention. If you're watching us on YouTube and you like this video, please hit that thumbs up button. Consider subscribing to the channel and hit that notification bell. It really helps out with the algorithm and gets this video to other people that might have the same interest as you. Again, we'll be doing this weekly update every Tuesday. I hope it'll come out. And we're going to continue this a couple more weeks. And I would encourage you to go to MontroseCountyJIC.com for updates there. We will update that website every Friday for the foreseeable several weeks ahead. So that concludes our visit. Thanks for your attention today. Have a great rest of the week.